Greetings, everyone. Thank you for joining us for yet another episode of the Social Impact Voices. Today, as we commemorate July month, which in South Africa acknowledges Nelson Mandela Day on the 18th of July. We are so excited to celebrate leaders such as Nelson Mandela, but also young leaders that have since followed. And today I have the pleasure of interviewing a trailblazer, a leader who's also making a mark not only on the South African soil, but across the world. One of the winners of the 2023 Alkerbulin Immigrants Impact Award winner, Dr. Bettina Buabeng-Baidoo. Dr. Bettina, a very warm welcome to this episode of the Social Impact Voices. It's a great pleasure to have you today.
Thank you so much for having me. I'm so privileged to be here. Thank you for giving me the opportunity. And a warm welcome to everyone who is watching this video. I hope that you are well and blessed wherever you're watching this from.
Well, certainly. Now, Dr. Bettina, before we get to the crux of how did you become the winner, tell us more about your journey to coming to South Africa and deciding to make South Africa home. When did you arrive? How did you arrive? And how was the experience in the first initial months, years, and so forth of your time in South Africa?
Wow, I don't think I had much choice in making South Africa home. So I moved to South Africa when I was 6 years old. So I am the daughter of Bettina Buabeng-Baidoo and Rosemond and Kruma Baidoo, and they were born and raised in a village in Ghana called Bettina, which is in the central region of Ghana. And my dad was working for an NGO in the early 2000s, and his job relocated him to South Africa, where the headquarters of the African base for the NGO was. And we came along with him as his 5 children. And I was one of the children that came along with them in 2002. And we've been in South Africa ever since. And yeah, that's how we came to be there. I think in the beginning, it was very different for us. So even though, Ghana has a lot of industrialized areas, where we were from at the time, predominantly was a village. So coming from there to South Africa, I remember we were just like starstruck at all the infrastructure and how different it was to where we came from. And I think in the beginning, because we didn't really speak English that well, so it was a little bit tough fitting in. And I remember like being quite embarrassed at school to speak because I had a different accent and I was a lot more darker skinned than my other friends. So there were those nuances, but I think once you settled in, just being a child meant that, it quickly grew on us and it quickly became a lot more settled in SA. So yeah, that's my immigrant story of how I came to be in South Africa.
Oh, wow, that's quite interesting. And just acknowledging that the time that you would have arrived in South Africa was also the dawn of the new South Africa. So you've journeyed with what we call the born freeze, really through the schooling career, or the schooling journey, or the years where we had the opportunity to go to school with mixed race and so forth. So did you experience that? I suppose it was new to you anyway, but was there a difference? Did you feel that there was a new experience for South Africans around you, or because we were that generation that joined school with you was typically born free, you navigated the spaces as though this was the norm?
Yeah, I think probably much of the latter, Simpiba. I think, growing up, I really wasn't aware of the fact that South Africa was aging with me. I wasn't aware of how young a democracy South Africa was at the time. And only, when I was in high school and university and learning about South Africa's history more in depth and, becoming a scholar of Steve Van Biko, etc., that I really understand, how fresh the country was at the time that we arrived and that we basically grew up with South Africa. By the time when I was in most of my schooling career, it really felt like the norm. It felt like how things had always been. But now to sit on the other side of it and to look back at South Africa through the history, we really were at a turning point. And we weren't even that aware that, this wasn't the norm for so many people that came before us. And just the gratitude to so many South Africans, who fought for the ability for us to sit in those classrooms, for us to learn in the way that we were able to learn, just the gratitude for the legacy of Madiba and so many others that were part of the struggle.
No, thank you for that, Dr. Bettina. Now, coming to your journey now as a recipient of the Alkebulan Immigrant Impact Awards. So when the awards were started, the idea was to acknowledge the great work that young people who are immigrants living in South Africa was doing in the country. And you were seen as one of those young people under the age of 30, really just breaking new grounds and really having an impact, especially in the area of public health. Can you tell us more about your journey? What inspired you to go into the work that you do, and also where you are today, and maybe just sharing the various platforms that you've been a part of that then saw you being acknowledged as part of the AYA award recipients in 2023?
Thank you so much, Cynthia. I think, whenever anybody asks me that question, I never know where to start, because I think my career has had so many different elements to it. And I really love that as well, the fact that I can explore those elements. So I'll start off with medicine. So predominantly, I studied medicine in university to become a medical doctor. And a lot of that inspiration was drawn from my Christian faith. I really believe that healing ministry to Christ was central. So many of the miracles that Jesus performs in the Bible are miracles of the body, miracles of the mind, and miracles of the body. And I think that's because the way we interact with our world, the way we interact with our own conscious is so linked fundamentally to our body. And to really become part of that ministry, I wanted to be a healer. And being a doctor was one of the ways I conceptualized healing. But for me, healing isn't just, curing a disease. For me, healing is the holistic frame of working with the patient, through the difficulties of having to conceptualize and understand an illness, all the way, to whether it gets better or not, but to actually hold somebody's hand through that process. And I always think that's a privilege that any of us have. And that was essentially the first elements of my career and why I chose to become a doctor. But, as I was going through medical school, I became quite upset at the apolitical blindness of medicine. It was so concerning to me that this industry that was fundamentally dealing with what it meant to be human and what it meant to live a dignified life as a human saw itself sometimes as being separate from the socio-political conversations of the country that we were living in. And as you know, Cynthia, as you've highlighted, in South Africa, that is charged by so many different histories and realities that we need to be able to, bear in mind and respond to. And therefore, I went into public health because I really believe that I don't want to just treat symptoms of a problem. I want to be involved in the larger, broader system that is creating those problems and to respond to that larger, broader system. And that's why I went and studied a master's in public health, interestingly, under the Mandela Rhodes Fellowship. So it being Mandela Month, I'm really, really grateful for that. I'm grateful for the legacy of Madiba, which actually allowed me to pursue a career in public health. And from there, I went on to become a youth advocate specifically in health system strengthening. I worked with the Africa CDC as a vaccine advocate for them. I'm also currently now the co-executive director of an international working group of health system strengthening. This is a public health organization of emerging change makers in the field of public health who are coming together to really understand how do we reimagine health. And what our work encapsulates is the fact that health was built at a time when many of us weren't allowed to have a say in what that health system looked like. Many of us were still under imperialist rule. The WHO was created in 1948, for example, when many of us were still being colonized. So now in this new age, how do we reimagine health? So that's the public health strand. And then very lastly is debating. So in high school, I was a debater. And after leaving high school, I really wanted to give back to the debating community. And I became more involved in the South African Schools Debating Board. And there I founded a writing competition, which since has published 4 anthologies. And it allows high school students in South Africa to contribute written pieces that we then publish in an anthology at the end of the year. And it's been one of the greatest highlights of my life. I've loved that competition and what we've been able to produce from it. Yeah, so I think all of those strands encapsulate what I've done and been involved in so far. And it's, yeah, so thank you for that. Sorry for the long-winded answer to that question.
No, thank you so much for the detail. In fact, I'm just amazed by your journey, firstly, by what a visionary you were as a young person. A lot of times when people are asked why they became a doctor or an accountant or a lawyer, it's because I'm going to make a lot of money. Or, it's not always the level of depth that you have shared at it's not only just about the profession, but for you it was a form of ministry, and you wanted to have impact. And moreover, even in the profession, when you started, you realized the gaps that are there from a public health service perspective, and you've really gone in deeper than just making it a job that pays you. So I commend you, actually, and I believe that is truly why when the nominations and ultimately you being seen as one of the recipients today, it is because of the impact of the work that you are doing. Interesting that you've journeyed through the debating journey as a student yourself and up to the point where you are today, and having published the work and the impact that you're having in that space. So really congratulations and thank you for championing the work that you currently do. Now, Dr. Bettina, just to also come back to the reality of well, maybe not choosing, but because of your dad choosing to settle in South Africa for the period that he has been, you ended up in South Africa and you've made it home. What are some of the challenges that you've had to go through as an immigrant in South Africa who's trying to do work that has positive impact? And how, maybe let's start off with what the challenges have been, and how have you navigated these spaces? Because today, even in the midst of challenges, you've been able to be the trailblazer that you are.
Wow, that's such a beautiful question. So I think South Africa and South African society, there's a number of positives, and I'm speaking to these challenges because that is the question that you've asked me. So I don't want to negate the positives that do exist in terms of being a foreign national in South Africa. However, I think in South Africa, being a foreign national and being a Black foreign national from an African country specifically, there are many challenges socially, and there are many challenges in the systems of South Africa itself. So I think socially, in the way that some people interact with you in South African society, no matter how long you've lived, and I was having a conversation about this with a friend yesterday who's also Ghanaian and grew up in South Africa, because I'm currently in Ghana at the moment, and she was saying the same thing, that no matter how long she lived in South Africa, some people would never make her feel like home. There would always be these underlying comments, these underlying aggressions, and make you feel uncomfortable and make you feel as though you don't belong in the society because you weren't born there. And that's very difficult to navigate. And on top of that, I think the systems in South Africa as well can be quite Afrophobic and can be quite limiting. There are so many spaces you can't access unless you're a citizen, or so many, points in your career that you can't get to unless you're a citizen, etc. And I think even for me, those limitations have meant having to make different decisions about my life, having to come back to Ghana to pursue certain elements of my career. And I know so many people who, have been affected by that same reality and by difficulties at home affairs, etc., that impact all foreigners and makes it really hard to exist and to live in the country and to want to make a positive impact and to want to contribute. So I think, from a social and legal and political system, there needs to be a re-looking at, those kind of elements. But in terms of overcoming, I think first of all, importantly for me, has always been my faith, and has been, God. I cannot say that, my family got through this alone or I got through this alone. It would be a lie to my reality. So much of it I really believe was miraculous and God taking us through. And I also believe in starting somewhere and telling someone your idea, no matter how ridiculous you think it is, no matter how big or small you think it is, starting somewhere, going out there and telling somebody. So with the book competition, for me, it was writing an email to somebody, an assistant for sexuality, AIDS, and gender. And I didn't really have a plan. I didn't really have much, but, them being like, oh, that's so interesting. Let's meet, let's talk about it. Let's see how we can do it. And I guess my encouragement would be, even if you're facing those challenges and you're navigating those systems, start somewhere, tell somebody your idea. Yeah.
Thank you so much for that answer. And as you say that, and thank you for sharing your truth. Oftentimes we are afraid to voice out some of the experiences that we've had, and we do acknowledge that they are challenges that South Africa still needs to address, especially when it comes to making the environment more socially cohesive for everyone living in South Africa. But also just highlighting that even in the midst of those challenges, you've been able to start the work that you do. And in fact, as you said it, you almost convicted me, because most of the time one will have ideas, but it's the starting that's delayed. You always say, okay, I still need to do this, I still need to do this, but it never happens if you don't start. So once again, well done to you for recognizing what needs to happen. And even if it's not all perfect, but starting where you can. And that I really commend. Now, just coming back to also, what would you say to fellow immigrants who have made South Africa home, but haven't yet maybe started from where they are, just to encourage to say, is it possible? And if so, what should they do? Where can they start in navigating and making a difference in their communities as well?
Wow, I think, I don't know, there's so many different places that you could be, and start is such a broad term in terms of, are you starting a schooling? Are you starting a project? Are you starting a company? So it can be so different. But I think, regardless of the kind of legal and social constraints in SA, there are so many organizations and people who will completely not look at your nationality, to whom, where you come from is not a barrier. And to me, it's about finding those spaces and finding those people who, if you're facing, legal challenges or challenges of status, will stand with you, right? Will be your backbone. And there are so many South African organizations that are helping foreign nationals, fight legal battles in court for things like permits. There's so many organizations that are supporting foreign nationals in South Africa. So I guess when I say start somewhere, it's also about finding the people who will be in your corner, and they do exist in South Africa. A number of people, a number of organizations whom your nationality will not be a barrier, and who will be willing to speak to you and engage with you and help you.
Thank you so much, Dr. Bettina, for that. And in closing, maybe if you can just share with us what has been for you, what is meant to you, rather, knowing that somewhere in the world there were people who said, this young lady is a deserving recipient of the Al-Kebulan Immigrant Impact Awards because of the work that you do. And what does this platform actually mean to you personally?
Wow. I was so blown away and so humbled and so grateful to have received that award. I unfortunately wasn't able to attend the award ceremony, but I was so jealous. My sister was sending me photos and videos, and I was like, oh my gosh, I wish I could have been there just to experience that. So thank you so much for the celebration that you had, the celebration of culture and color that you had, at the Alkebulan Movements Awards. It was so beautiful to see it in pictures. Now, I wish I had experienced it. For me, this platform really is what I think we need in terms of creating national unity and responding to the problems that I mentioned before. As I was alluding to before, I think, there are a number of foreigners in South Africa who are suffering. And they are suffering because so often we paint foreign nationals with one paintbrush. And that paintbrush is this negative narrative that all of us are these parasitic entities that are trying to steal jobs and opportunities, and that we have nothing to contribute to society. And Chimamanda Ngozi Adichie always speaks about the danger of a single narrative and allowing a single narrative to be what prevails. And I think platforms like yours are so impressive and so important because they tell the counter stories. They tell the stories that we are not one entity. They're so different. I mean, the winners you have, they vary so much in nationality and the work that they're doing and how they're contributing. And seeing that difference, just being able to be part of that story that you're telling has been such a privilege, because I really think that your work is what we need in terms of being able to challenge those narratives and show that foreign nationals, many of us do want to contribute, are contributing, and do consider South Africa home and have a lot to offer when given the opportunity. So thank you for telling those stories and allowing me to tell my story to be part of this narrative. It has been such a privilege and a pleasure. Thank you.
Thank you so much, Dr. Bettina. It is indeed an honor for us, as we call ourselves AYA, which is the abbreviation for Alkebulan Immigrants Impact Awards, to have people of your caliber as recipients of the inaugural AYA Awards. So you will definitely go down in history as the recipients that really were the flagship for the awards. And we do hope that, as you've highlighted, the message of national unity and making South Africa home for everybody who lives in South Africa is really received and celebrated by those that interact with our platform. And we wish you the very best. We know that this is just the beginning. A young person with a vision like yours is certainly going to go far and make history. And we look forward to being part of your journey as well as Aya. Are there any parting words that you would like to leave for our viewers today?
No, just a big thank you so much for this opportunity once again, and really just, an encouragement to who's out there who wants to nominate someone or support AYA. This platform really is what we need in South Africa to create social cohesion. So just a shout out to you, and if, anybody's inspired to really be part of this movement, a huge encouragement to do so.
Thank you so much. And with that said, thank you, Dr. Bettina, once again. And thanks for highlighting that nominations actually are currently open for those who would like to nominate people like Dr. Bettina for the 2024 Alkebulan Awards, which will be taking place on the 25th of October, 2024 at the Maslow Hotel in Sandton. So if you would like to be a part of the awards or be one of the recipients for this year's awards, please do nominate. You can go to our website, which is www.ai-impactawards.co.za. We will also share the details at the bottom of the screen for you to then go and nominate your 2024 recipient. Dr. Bettina, it's been a great pleasure having you with us today.
So much. Thank you. Bye-bye.
I am suffering a bit of a cold today, but it's been a great, great, great pleasure. And before we sign off, I actually wanted to leave today's session with one of Nelson Mandela's quote that says, It is in your hands to make a better world for all who live in it. And that is our message this July month.